Assalamualaikum, good morning to my Alieyah, my lovely classmates. So my name is Puteri, and as for today, we are going to talk about one of the Sustainable Development Goal, which is the good health and well-being. And as for my presentation for today, we are going to focus more in terms of mental health issues after the pandemic. Okay, so firstly, let's talk about on what is health and well-being. So according to the World Health Organization Constitution, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. While according to a website known as CDC, well-being is an outcome that is beneficial for people and many sectors in society because it indicates that people think their lives are going well. So, good living circumstances such as a place to call a home and a job are essential to well-being. Okay, so what is actually the Sustainable Development Goal, SDG, for health and well-being? Because based on the United Nations, in order to establish thriving societies, the main goal is to ensure healthy lives and promote well-being for all at all ages. Okay, so the reason why I decided to choose this topic because I know that as humans we have the tendency to bring ourselves to a lot of difficulties, which in result has affected us into any kinds of mental health issues. So it took me some time to find a topic related to health and well-being, and a friend of mine suggested me that I should try to relate it to Covid-19 pandemic. So taking her advice and knowing that mental health has been one of the majorly terrible issues that happen in this era, I decided to talk about health and well-being in terms of mental health issues after the pandemic. Okay, so some of us might be wondering what happens if the Sustainable Development Goal doesn't include health and well-being as the third most important goal. So for me, I think there will be less emphasis and concern towards the amount of deaths and illnesses that have happened in recent years due to the virus infections, several diseases, or other issues such as maternal mortality and mental health. Okay, so what can we do to achieve this goal? Okay, so from here, there are three main important things that I have found based on my research, which is one of the article, Mental Illness Awareness and Support Association, or MEASA, contribution to support services, supply mental health experts, and establish safe home for children. So firstly, let's talk about one of the article that I found from Google, which is about Mental Illness Awareness and Support Association MEASA contribution to mental support services. Okay, so according to President Anita Abu Bakar, around 100,000 individuals had received mental support services from MEASA starting from August to March 2020, and most calls are those from the 25 to 40 years old and 8 years old. 8 years old were the youngest callers. Okay, so due to the tragic COVID-19 pandemic back in 2020, it is understandable to hear how such pandemic had affected the people not only in terms of illnesses, yet as well as many had lost their support system, which had also affected their mental health. In the Bernama report, people were pressured for not being able to interact physically with their friends and relatives, and even some children had their mental health affected too, due to the factors of inability to express their feelings when confined in their houses or whilst parents are busy. So because of the rising issues of mental health during the pandemic, which mostly are depression, having extreme anxiety, and suicidal thoughts, an event was launched by National Alliance on Mental Health, or known as NAMI, and the Petra Senator Datuk Ras Adi Baratzi at the Kuala Lumpur Football Stadium to raise awareness and urge the community not to be ashamed and to immediately seek support if they suspect that they have mental health problems. So, observing the MEASA and NAMI's aggressiveness and proactiveness in helping those in a bad mental health due to the pandemic, this had made me realize how important communication is in order to give mental support and motivation to those in need, especially after how long they have been quarantined at home alone, which causes a lot of them to have a breakdown. Okay, however, there's a high possibility that the majority of them won't be cured because just like viruses, curing mental health doesn't seem as easy as it seems. So medical treatment can be an exception, but with that many people, which is 100,000 individuals, is it possible for the health providers to help and cure all of them with it? Okay, so my first suggestion is to supply mental health experts. So imagine that among the 100,000 individuals with mental health problems, around 40,000 people are saved from the method made by Mayasa and Nami. Now all we had left is the 60,000 people. Okay, with the 60,000 people who had a terrible mental health and in need of help for support, try to find at least 10,000 people who have the ability to be mental health experts, and each of them are given at least 60 patients to manage, in which if 60 patients times 10,000 mental health experts, exactly 60,000 people have been saved. So, mental health experts can be someone from psychiatrists or volunteers who have the ability to give deep emotional support verbally, physically, and mentally. So, to get in touch with every patient, the experts will be needed to manage a schedule where in a day or two, each will take a good care of a patient and will stay close and connected with them whenever in need. This method might be super useful, especially for those who have longed for affection and a company, and with the experts able to focus on taking care for every of them, this might have the possibility for the patients to realize how there are still more people who still care and love them. Okay, so my second suggestion is to establish a safe home for children. Okay, so this suggestion is used for the children who were neglected or abandoned during the pandemic and had a serious bad mental health which has caused them to feel unloved and unable to express their feelings. Safe homes are like a combination of pediatric ward and kindergarten where the children are able to be well taken care of while their parents are unavailable. From this place, fun activities will be hosted for them and there will be medical treatment and support for the children. So now we have moved on to the conclusion. Well, from based on everything that I said, so good communication, showing love and care are the most significant things when it comes to helping those with a breakdown in mental health. I know that it is tough to talk about mental illness and the profound despair that it brings, and holding our thoughts and feelings inside makes us feel more sicker, and doing so can lead to further unpleasant feelings and unease, putting us on destructive paths. As hard as it is to talk about our pain, it is much harder to live with it in silence. So, seek help from the people that you love and trust, and if there are none, remind yourself that there will always be someone who cares for you and loves you. Because just as the quote Lisa Oliveira had stated, just because no one else can heal and do the inner work for you, doesn't mean that you can, should, or need to do it alone. So that is all for today, and thank you so much for listening.